Ladies and gentlemen, welcome back to the channel. This is Ray Owen Tech. I hope everyone is doing well. For this video, um, we have a cybersecurity framework assignment. This is going to be more tailored towards an organization. What this is used for is just ensuring that all of the cybersecurity details, as well as security measures of compliance and policies, are met. And so because I'm passionate about like healthcare and the healthcare information, I decided to use the Augusta Medical Hospital as my reference today. So I'll pretty much be talking about like different techniques of how to not only just secure their organization, but also different business needs as well as ways to help mitigate any potential cybersecurity risks. So if you guys like this type of series, I might just call it the Playbook series. Where it's going to be like a security playbook for each company, which I'm kind of thinking of like the best way to secure it. But if you guys like kind of the concept, just like, comment, and subscribe. Just be free to comment any other organizations you kind of want me to like look at the security with and kind of make like a general framework. Other than that, super excited. We got a lot of cool content today. Like, comment, subscribe, and see you guys in a bit. First things first, we'll be using the ISO IEC 27001 framework. This is the standard which specifies requirements for the design and implementation of an appropriate information security management system within an organization. This ensures that adequate and proportionate controls are selected to protect information assets, also to give confidence as well to interested parties. So, what's really great about using this type of framework is that this pretty much helps ensure that any type of security controls and the management behind those security controls are not only protected, but they also help boost security and like trust and the confidence overall of whomever may be affected. So this is why it's important to have vulnerability assessments as well as security audits within the organization. So being able to have consistent testing and also consistent different ways of staying in compliance make sure that the organization itself, which this organization is the Augusta Health Hospital, stays secure. So that's just one way of staying within compliance of using this framework. So the next way of doing that is using the three different types of policies within compliance. So we see first, there's three types of policies here. The first one is known as HIPAA. HIPAA is like the main health standard policy where health providers as well as different health organizations must follow. And this means that the protection and security of personal health information must be secured. So if they follow HIPAA, it's mandatory that they follow it within compliance. All the hospitals follow it, and they already do follow it. But this is just pretty much like additional ways of staying within compliance. And also, their employees must follow the HIPAA policy of compliance as well. Number two is the GDPR. So, depending on if the Augusta Hospital has potential clientele within the European Union, so they would have to follow the GDPR. Pretty much, this is known as the main way to protect the security and information of personal information of European citizens. Also, they could follow the CCPA, which is the California Consumer Privacy Act. Pretty much that focuses on the privacy and protection of each consumer within California. So that happens within different businesses, different avenues, different foundations. Lastly is the HITECH, which is the Health Information Technology for Economic and Clinical Health Act. Pretty much HITECH ensures that information technology within the actual hospital has to be secure, and it also has to make sure that it follows security for their clientele and their patients' data and information. So the best ways of not only just staying in compliance but also integrating the framework, these all kind of fall within like a, let's say, like a security plan in itself. And so the best way to do this would be to prioritize business needs within an organization. And so one of the best ways of prioritizing business needs are, number one, following the principles of the CIA triad. And so the CIA triad is known as confidentiality, integrity, and availability. And so these are the three main components which organizations, especially health information, needs to follow, because Having this ensures safety and security of patient records. Number two is ensuring all devices, including medical devices and devices connected to IoT, which is the Internet of Things, are secured. So having security checks pretty much scanned for any vulnerabilities is very important for this. Um, this just ensures that any devices which are connected, because medical devices are like pacemakers, for an example, and so we want to make sure that devices are secure, because if devices are secure, then no vulnerabilities can kind of persist through them. Number three is what would really help the hospital is having proper incident response planning as well as disaster recovery planning. This helps ensure operations within the hospital are secure in case of emergencies. So if they have proper planning of responding to incidents as well as disasters as well, what would ensure is that they would be able to respond to it quicker because they've already prepared for it. Number four is ensuring information is secure and hardened. Pretty much having sensitive health information, sensitive just information in general, is hardened within like their security. This not only helps boost trust of the uh, customer trust of whom their information they're guarding, it also helps build the integrity as well. Yeah, just like as I mentioned with number six, data integrity, pretty much having the sensitive information is verified and approved. This not only helps communication between the patients, but also the healthcare providers as well. And lastly, number five is the increased security and user authentication. So, using the technique of multi factor as well as VPN for employees, this pretty much helps employees enter the internal network securely, and also the multi-factor kind of has the authentication type of practice. Where what that does is it helps boost security within the organization because it helps verify the user by making sure that they have a proper device which they can use. So it's like not only who they are but also what they own. So pretty much having that type of extra layer of security really helps prioritize business needs of boosting security overall. So those are just like six types of business needs which can be prioritized within the organization. So, as we know, business needs are necessary, but it's also important to understand the different types of risks which could occur as well. And so, the best way to do this is identify the risk. So, the first way of identifying potential risk within the company or to understand the type of risk which could happen within the company. So, if we think about the healthcare industry and the Augusta Medical Hospital, it's very common for them to have one ransomware attacks. So, ransomware is a type of malicious attack where the user will lock out sensitive information and they would need some sort of ransom in order to pay that fine and get their sensitive information released. So what's really bad about this is if this happens within the actual hospital, this could disrupt a lot of like hospital systems, especially during critical times where we need technology to be active. And so that's just like one potential risk what could happen. Another risk is social engineering and phishing attacks. We've seen a lot of cases with this where social engineering attacks will occur, as well as phishing attacks, where they will be replicating potential HR employees. Even though they're not legit, they'll try to target medical personnel who work there in order to gain access and gain information to sensitive information they're not supposed to be getting. And so that's one thing to watch out for. Also, number three is vulnerabilities within hardware. As I mentioned with pacemakers and even older hardware as well, we have to make sure that they're secure, not only uh, within like their security, but also just overall, because we don't want any potential health data being sniffed. And because if it's sniffed, it can affect the overall integrity of that data as well. And, we're trying to protect the patients here. Number four, as I mentioned earlier with hardware, it's important to also understand any vulnerabilities which may persist within legacy systems. So older systems within the hospital are known for having older vulnerabilities, which may persist within that system. So if the hospital uses those older vulnerabilities, what's going to happen is that that's going to create any potential attack vectors currently within that organization. And so it's important to just make sure that you're staying on top of your security, make sure that everything is updated, make sure that you have like firewalls, make sure you have these different types of managing controls in order to help prevent these type of cybersecurity risks. Number five is insider threats. Even though this might be a little Disgruntled employees or potential third-party vendors could maliciously expose sensitive personal health data and information. So it's important they follow the laws and stay within compliance, and also make sure that there's proper documentation and like a contract assessed of if any of those are broken, then potential legal penalties and fines will occur. So very important how these can identify security risks. So next, I'll mention how I talked about managing security risks within this organization. Number one is data encryption. So because we're working with personal health information, we didn't make sure that this data is secure overall. And so the best way to do that is ensuring that we use like TLS, we use SSL, socket layer security. I believe that's what it's called. But pretty much using different secured channels in order to ensure that the data in transit and at rest is encrypted across the channels. So having this with a mixture of multi-factor authentication for not only employees and health users as well, this will help like boost security overall. It also adds an extra layer of security. So I've talked about the concept of least privilege, and what that means is that ensuring that employees have only privilege to what they need, and only authorized personnel have more privilege than others, because doing this will make it easier to prevent privilege escalation, which is a type of attack where potential hacker will use one account in order to gain access to like an administrative account and try to use more controls and take over the system. Number three is proper security and awareness training. So by being able to conduct proper awareness trainings and like security assessments, also just security campaigns within like the organization for the employees, this helps boost security and awareness overall for employees. Also, this can be used for third-party vendors as well. So it's pretty much good whenever you have like compliance checks and audits, because when you do that, you just stay on top of security. How privacy principles are integrated within the hospital. So I've talked about least privileged, but one important thing to understand is data minimization. Data minimization is the concept of being able to only use data for what is necessary. So we don't want to have excess data out there. We don't want to make sure that older data is still within like our system. So that's why it's important to minimize what we use it for. Like we let them know who's using it, we let them know why they're using it, and once it's no longer used, make sure that it's properly disposed as well. Because one of the biggest things that could occur is that we've seen that older companies could have older data on legacy systems, and that could technically be breached and still create havoc for their sensitive like patients and users as well. So we see with proper communication between patients regarding how data is used and shared and approximately and legally, it's very nice to know that it's disclosed and usable only by a personal, only by authorized personnel, and it just makes them have more integrity overall. So the overall impact of legal and regulatory standards, security controls and encryption standard, make sure that they follow all security controls overall, as well as encryption standards within the organization, as well as different elements. To having proper monitoring and logging and helping secure sensitive data. So having proper monitoring, what this does is that it ensures that different detection systems, as well as like intrusion detection, intrusion prevention systems, are used to help monitor kind of like how the data is it's being passed every day. Using logging is good, so especially when you have audits, they can pretty much check the log just to ensure that no sensitive information is being sniffed out. Also, it's really good just to check it daily. Lastly, with incident reporting and disaster recovery planning, these are both really great measures of ensuring mitigation overall without through the healthcare industry. So with them, they have incident reporting and disaster recovery plan. Pretty much, they use this as a way for preparing overall. So, lastly, this is my reference. What I used. This is from Poor. Pretty much, it talks about the ISO IEC 27001 framework. So, yeah, that's pretty much just like my presentation, just regarding of how to help boost the security structure of the Augusta Medical Hospital. So, if you guys like the video, just like, comment, subscribe. Other than that, I appreciate you guys. Stay blessed and have an amazing day, you guys. Peace. Rayo and Tech out.